Hi, I'm Dr. Harry Oken for Columbia Matters. Today we're going to be talking about memory and how our memory changes as we age. With me today is Dr. Majid Fotuhi, who's the medical director of our local NeurExpand Brain Center, a really interesting place that we have at Columbia, one of its kind. Welcome today.
Thank you very much, Harry.
So we're going to talk about memory and how we age, and it's so important because Alzheimer's disease is such a prevalent phenomenon. About how many people in America have Alzheimer's?
About 5.4 million Americans suffer from Alzheimer's disease. But it's important to know that not everybody who has memory problems is in early stages of Alzheimer's disease. A lot of people have age-associated memory impairment. You know, it's very interesting. The memory part of the brain, which is called hippocampus,
Why don't you show
which
us?
is somewhere deep in the brain, in the temporal lobe, size of your thumb, sits deep in the brain, is important for memory, and this part of the brain is very vulnerable. It shrinks by about 0.5% per year after age 50, and that's why people have memory problems. But the good news is that even though hippocampus shrinks easily, it also expands easily, and that's why we have opened up our NeurExpand Brain Center, where we focus on helping people improve their memory by increasing the size of their hippocampus.
Excellent. And so why don't you tell us a little bit about early signs of memory impairment? What do people worry about? What do we see? And what is concerning?
If you forget your keys or can't find your car occasionally in the parking lot, that's not too concerning. However, if you or somebody you know forgets major events and would not remember it with queuing, then that is concerning. For example, if your mother's gone to a wedding and on Sunday she asks, what are we doing, or when are we going to such a person's wedding, and it was the night before, that's concerning.
And I don't remember it's the night before, I have a problem.
Yes.
Right.
If you forget major events and would not remember it when people give you a clue, that's concerning. Mm-hmm. If somebody gives you a clue and say, oh yeah, I remember that, that's not as bad.
So this is really a very huge impending problem because America is aging so much. The baby boomers are getting to this age now where they're very vulnerable to memory impairment and then dementia. So I think it's projected, and you would know the figures, that really in 10, 15 years, the numbers of people that may succumb to this are quite huge. Is that right?
Yes. By 2050, the number of people who have Alzheimer's disease will be 3 times more than what it is today.
Wow.
But I'm an optimistic person, and I like to focus on the positive. The positive, hopeful news is that in many Western countries, such as England, Sweden, Norway, the incidence of Alzheimer's is actually going down. And people think that the reason fewer people in their 80s are developing Alzheimer's disease has to do with the fact that they stay active, the fact that they exercise, and the fact that they become conscious of the factors that affect their brain.
Right.
So while the population is aging and we will have a tsunami of patients with Alzheimer's disease, it's also important to realize that there are many things we could do to reduce our own risk for developing Alzheimer's disease.
Okay, that's encouraging information. So let's talk a little bit about the diagnosis of memory impairment and how you sort out just plain old age-related memory impairment from something more ominous like Alzheimer's dementia or other types of dementia.
Yeah, that's an excellent question. Many different factors can cause memory problems, and not everybody who has memory loss, even when it's severe, has Alzheimer's disease. For example, a person with severe B12 deficiency, or someone with thyroid problems, or someone with depression can have significant memory loss. What we do in taking care of a patient like that is to establish the causes for memory loss in that person, and also establish the degree and severity of memory issues. So after I spend an hour with a patient, I have a good feel for what's causing the memory loss, how bad it is, and more importantly, what we can do to reverse it. And the way to distinguish sort of mild memory problems versus concerning is by asking specific questions from the family. Questions such as, is the patient repeating herself? Is the person asking the same question 4 or 5 times and they forget it every time you explain to them? And again, realizing that not everybody with memory loss necessarily has Alzheimer's disease. So what happens with aging and also with dementia is that multiple factors can affect the brain in different ways, one of which is Alzheimer's. So for example, the person may have a silent stroke, that's causing a problem. Another person may have depression. Another person may have undiagnosed attention deficit disorder. So we do a full analysis to establish how much of the memory problems could be attributed to Alzheimer's, how much of it may be due to concussion, stroke, attention deficit, or medical problems.
Right.
And then we focus on treating the treatable causes.
Excellent. So this brain center here, NeurExpand, does that comprehensively. And when someone comes in for an evaluation, what could they expect?
They expect to see a neurologist for a first-time visit. After the neurologist visit, they may need several tests. They will come back to see the neurologist to review the results and get a feel for where they stand in a big picture with regards to their brain function. Are they 2 out of 10 or are they 9 out of 10? A lot of times people underestimate what they can do. They have a low self-esteem about their brain function. And we're surprised to find out that they're actually on top 5%, even though they feel they're declining. And then people who have significant cognitive decline will start our brain fitness program, which is an intensive 3-month program, 6 hours a week, to rejuvenate the brain, to literally stimulate their brain and improve their brain function by 5, 10, or 15%. Our program is very much similar to the study that was presented at Alzheimer's conference 2 weeks ago. We provide cognitive stimulation, counseling for stress reduction, neurofeedback, and taking care of important medical issues such as sleep apnea, vitamin deficiency, and other medical issues.
Excellent information. Thank you for joining us today.
My pleasure.